Hello, so currently I had to go for my certified residential medication aid again. So I made a 3-part thing that's quite long. The third part's probably the smallest because it's the least I have to talk. So this is part 1, what you need to know. Objectives. Discuss a general knowledge and understanding of medications. Understand knowledge of medication classifications. Know the proper procedure for storage of medications. Know the proper procedures for reporting and recording physical and behavioral changes of a client. Understand the documentation of medications. Gain a basic knowledge of disease and infection. Knowledge of resources and references for the CRMA. Know the basic knowledge of common disease, know some human anatomy, and the correct procedure for taking vital signs. Your role as a certified residential, observe people for changes in physical and behavioral signs, reporting significant changes to the right person at the right time by the right means, recording medication information on appropriate forms, administrating medications correctly. As a CRMA, always remember you must understand the facility medication policy, knowledge of and respect residential rights, knowledge of what is necessary to ensure safety of residents, knowledge of how to approach residents, knowledge of the medications that residents are taking and why they are taking them, knowledge of correct administration of the drug according to the physician's orders. You must know how to administer non-injectable medications in a manner that is safe, proper, and accurate. So, limitations. It's important that you understand that your certification allows you to administer medications in Maine and only in facilities covered under the regulations that provided the authorization for your training. Even though your employer may have paid for your training, the certification is yours. You have earned it. Be sure to understand your responsibility in relation to any medication policy within your workplace. Be sure of your company's regulations and know what is expected of you. How you are to document your actions and who is responsible for supervising you. So, who am I? As a CRMA, you are responsible for monitoring medication errors, receiving and counting medications, taking vital signs, documentation for medical records, practicing quality assurance procedures, maintaining confidentiality, pursue ongoing training, maintain certification, administer medications, and review residents' medical status. In your company, though you are not alone and share some of these responsibilities, administrators, pharmacists, directors, care staff, and nurses all are there to help you and the client. So state regulations. This is not going to go over every state regulation because there are so many, so I just grabbed out a few. So you have section 7.1, use of safe and acceptable procedures. This section states that the person administering the medication will use safe and acceptable procedures for ordering, receiving, storing, administrating, documenting, packaging, discontinuing, and destroying of medications. All employees must practice proper hand washing and aseptic techniques. Section 7.1 of 1. Residents shall receive only medications ordered by his or her duly authorized licensed practitioner in the correct dosage at the correct time and by the correct route of admission, consistent with standards. Section 7.1.2. No injectable medications may be administered by an unlicensed person, with the exception of a bee sting kit, EpiPen, and insulin. Section 7.1.7. Orders of medications and treatments shall be in writing, signed, and dated by a duly authorized licensed practitioner, and shall be in effect for the time specified by the practitioner, but in no case exceed 12 months, unless there is a written reorder. Orders for psychotropic medications shall be reissued every 3 months unless indicated by authorized practitioner. Okay, so then there's section 721, self-administration. Upon admission, each individual's ability to self-administer medications will be determined by an assessment of his or her ability or need for assistance, unless the residential/legal representative elects, in writing, to have the facility administer his or her medication. Section 7221. Telephone orders shall be only accepted by a registered or licensed nurse or pharmacist. Written dated orders for telephone orders must be signed by a duly authorized licensed practitioner within 5 working days. A person qualified to administer medications must be on site at the facility whenever a resident has medications prescribed as needed, or PRN, if this medication is not self-administered. Section 734. Medications administered by the assisted living program or residential care facility, which require refrigeration, shall be kept safely stored and separate from food by placement in a special tray or container, except vaccines. Refrigeration shall not exceed 41 degrees Fahrenheit. Section 7.4, temporary absences. When a temporary absence from the facility is expected to be greater than 72 hours, medications leaving the facility must be in a form packaged and labeled by a pharmacist. For medications leaving the facility for 72 hours or less, the medication shall be packaged in such a way as to facilitate self-administration or admission by a responsible party of the correct medication at the appropriate time. Section 12.1. Individual medication/treatment administration records shall be maintained for each resident and shall include all treatments and medications ordered by the duly authorized licensed practitioner. The name of the medication, dosage, route, and time to be given shall be recorded in the medication treatment administration record. So if there's anything here you want to stop and pause and reread yourself, go ahead and pause now. So then next we want to go over some basic anatomy and physiology. Before learning about medication and proper administration of medication, it is important to know the basic information about the body and its systems and functions. The following pages include basic systems including the skeletal system, muscular system, respiratory system, digestive system, urinary system, integumentary system, cardiovascular system, nervous system, and the endocrine system. So the skeletal system. I have an image here I found that talks about the different bones and where they are. So the skeletal system. There are 3 main functions of the skeletal structure in the skeletal system: structure and support, blood cell production, and calcium storage. Some diseases that can affect your skeletal system are leukemia, osteoporosis, arthritis, and bursitis. Osteoporosis is a loss of bone mass, which can lead to fractures. Arthritis is a condition which there is an inflammation and an eventual destruction of joints. The 2 kinds are respiratory and osteo. First aid for a sprain or fracture is rest, ice, compression, and elevate. The muscular system. The main function of a muscular system is movement, but it also helps stabilize our joints, maintain our posture, and generate heat during activity. Movement of our body can be voluntary and controlled by the skeletal muscles, or it can be involuntary and controlled by smooth muscles. Disease and problems with your muscular system include sprains, strains, and muscular dystrophy. Muscular dystrophy is a weakness of the spinal muscles and a gradual decline of muscular function. Respiratory system. Function. The human respiratory system is a series of organs responsible for taking in oxygen and expelling carbon dioxide. The primary organs of the respiratory system are lungs, which carry out this exchange of gases as we breathe. Diseases associated with it are COPD, asthma, bronchitis, cancer, tuberculosis, and cold and the flu. The majority of respiratory infections are caused by viruses. COPD is a chronic disease of the respiratory system, usually caused by smoking, cigarettes, or chronic asthma. 4 common signs of the asthma attack include breathlessness, wheezing, dry cough, an increase in mucus. If albuterol and a steroid inhaler are to be given, albuterol needs to be given first to open the airways. To prevent infection, the best practice is to use universal precautions and good hand washing. Digestive system function break down the food into nutrients in the body and can use nourished cells and excrete feces. Disease, constipation, diarrhea, cancer of all the organs, hernias, ulcers, and diabetes. Facts for CRMA. The top 3 factors other than medication that can contribute to constipation are the lack of exercise, fiber, and fluid. Then we have the urinary system. Function, excrete urine from the body and maintain fluid balance. Diseases, cancer, infection, kidney disease, and incontinence. Facts for CRMA. The organ in the urinary system that filters blood in the kidneys. Incontinence is more common in women than men. For a urinary infection, lower back pain, burning when urinating, and elevated temperature and difficulty urinating. Interregiment system functions. This is the skin and skin derivatives, hair glands, nails, receptors. It has many functions. It protects the body's internal living tissue and organs. This includes burns. Diseases include burns, cancer, eczema, ulcers. Facts. A doctor's order is required to apply bug repellent and sunscreen. Signs of a wound infection are pus, heat, swelling, redness, and pain. Then you have the cardiovascular system. The function of this is it pumps blood around the body and controls body temperature. Diseases, angina, heart attack, vascular disease, anemia, HIV, AIDS, and congestive heart failure. Facts for CRMA. Congestive heart failure is a condition caused by weak heart in which the blood backs up into the veins and vital organs. HPV is the most common sexually transmitted disease in the USA. Gardasil vaccine protects from strains that cause cervical cancer in women and genital warts in men. The nervous system functions, transmit messages between environment and brain and body, and control the body systems. Diseases, degenerative disease, stroke, Alzheimer's disease, multiple sclerosis, Lou Gehrig's disease, Parkinson's, spinal cord injury, dementia, anxiety, depression, bipolar disorder, and depression. Facts. Seizures are thought to be caused by massive discharges of electrical impulses in the brain, with no control associated with discharge. Alzheimer's disease is a type of irreversible dementia and the 6th leading cause of death in the USA. Keeping the brain and body active will help prevent the disease. Then you have the endocrine system. The endocrine system works alongside the nervous system. It is a network of glands across the body that secrete chemical messages called hormones. Instead of using nerves to transmit information, this system uses blood vessels. Different hormones produce different behaviors. So diseases, goitre, diabetes, dwarfism, giantism. Facts for CRMA. The most common signs of diabetes type 1 are an increased thirst, increased urination, and weight loss. Successful treatment of diabetes requires healthy foods and portion control, blood sugar testing, exercise, and medication to lower blood sugar such as insulin and oral hypoglycemics. Dizziness, headache, fatigue, confusion, and sweating are all signs of a low blood sugar. Treatment for low blood sugar can be an 8-ounce glass of milk, a 4-ounce glass of juice, or a 4 glucose tablets, or 1 tube of glucose gel. So then we move on to common diseases and infections. It is important to know some basic information about the body and its functions. Knowing some common diseases and infections is also important. Diseases may spread through direct contact, such as handshaking. The best way to prevent spreading infection is to wash your hands. The most common diseases in this group includes conjunctivitis, head lice, and scabies. Conjunctivitis. This is the most common cause of red irritated eye. This is commonly called pink eye. It is usually caused by a virus similar to the one that causes the common cold. However, some forms are bacterial in nature. Conjunctivitis is highly contagious. It can be spread by coughing, sneezing, or sharing items that touch the eye, like makeup. Head lice. Head lice lives in the hair and the scalp of humans, where they feed on blood. You can catch them by coming in direct contact with an infected person's head or belongings. Medicated shampoos or hair rinses are usually prescribed to kill lice. Scabies. Scabies is a highly contagious skin disease caused by a parasite which burrows under the skin. Scabies is usually spread from person to person by close physical contact. Medicated creams or lotions are prescribed to kill the mites. Respiratory diseases. These are spread through the air when a person opens their mouth, runny nose, and saliva. The most common respiratory infections are caused by viruses, which produce cold and flus. Some respiratory diseases are from pneumonia, tuberculosis, influenza, and strep throat. Diabetes. There are 2 types of diabetes. Type 1 is also known as insulin dependent, and type 2 known as non-insulin dependent. So here we talk about the systems of medical measurements. There are 3 systems of medical measurements that may be used in the administration of medication. 1, household systems, 2, apothecary systems, and 3, the metric system. The household system uses tablespoon and teaspoon. The metric system uses meters, grams, and liters. Apothecary system uses ounces, dram, and grain. Dram and grain are not much used now. For your CRMA, there is some basic measurements and information that should be known. First, it is important to use measuring devices and not tableware. Teaspoons and tablespoons that you eat with are not accurate forms of measurement. Secondly, it is important to know how to convert these and back again. So, measurement conversion for the metric system. 1 kilogram equals 1,000 grams. 1 gram equals 1,000 milligrams. 1 milligram equals 1,000 micrograms. For volume, 1 kiloliter equals 1,000 liters. 1 liter equals 100,000 milliliters or 1,000 cubic centimeters. For length, 1 kilometer equals 100,000 meters. 1 meter equals 1,000 millimeters. Household system. 1 teaspoon equals 5 milliliters. 3 teaspoons equals 1 tablespoon, which also equals 15 milliliters. 2 tablespoons equals 1 ounce, which equals 30 milliliters. So if you need time to actually stop and look at this and go over it, you can pause it now. So here are some of the medical abbreviations. So you have QOD, every other day. ML is milliliter. QD is every day. PR, per rectum. TID, 3 times a day. OTC, over the counter. HS, hour of sleep, aka before bed. PO is by mouth. NPO is nothing by mouth. PC is after meals. BID is twice a day. G is gram. TSP is teaspoon. CO is complaints of. PRN is as needed. OU is both eyes. AD is right ear. QID is 4 times a day. GTT is drop. DC is discontinued. TBSP is tablespoon. AC before meals. BP is blood pressure. CC is cubic centimeter. Stat immediately. SC is subcutaneous. SL is sublingual. Sup is suppository. Q3H is every 3 hours. And mg is milligram. Medication names. We need to identify drugs in some way. There are 4 types of names that a single drug may be given. One is its chemical name. If we want to order a pure form, then we might use the chemical name, which is a precise description of the drug's chemical composition and molecule structure. Generic. We often order a drug by its generic name for ordering purposes. The generic name is usually much simpler than the chemical name and assures us that we are getting the drug we want. These drugs can usually be purchased for less. Trade or brand. We can also use the trade or brand name for the drug. The company that has developed its own variation of the drug usually has copyrights to this name. We see trade names in most advertisement and publicity. And then we have the official name. Often this is the same as its generic name, but with a USP added at the end of it. The USP stands for United States Pharmacopoeia. Medication categories. Medications are given into 2 major categories, prescription and non-prescription. The difference of these 2 groups is how we as consumers access the medication. Prescription medications require us to have an order from a duly authorized licensed practitioner before we can purchase them. Never administer a medication without a signed and date-written order. Usually medications that are available over the counter will be included in standing orders. Medications in both categories must be stored and administered as required by law. Prescription medications are divided into 2 subcategories, controlled and non-controlled substances. So, controlled substances. The Harrison Narcotics Act of 1914 first regulated drugs of abuse. The Controlled Substance Act of 1970 replaced the original act and classifies drugs covered by law in 5 schedules, according to their potential for abuse and risk of bodily harm. So, Schedule 1 substances have a high potential for abuse and no currently accepted medical use. For example, LSD, heroin. Schedule 2 substances have a high potential for abuse but are currently accepted for medical use. Destruction of these medications can only be done by a licensed pharmacist, member of commissions on pharmacy, a representative of the Drug Enforcement Agency, or a representative of the Department of Health and Human Services. Schedule 3 substances have a lower abuse potential than Schedule 2, but many produce low to moderate physical dependence, for example, narcotics, in combination with non-narcotic ingredients. Schedule 4 substances have a lower abuse but still may produce some dependence. Schedule 5 substances have limited physical or psychological dependence. So we have some medication classifications here, 17 of them. So we have bronchodilators, action, opens your airways, analgesics, treatment, action, treat pain, antibiotics, action, treat infection, NSAID, action, treat pain, swelling, and fever, antidepressants, treat depression, antihypolipid, emic, lowers fat in blood, Anticonvulsant treats seizures. Antipyretic lowers fever. Acid or H2 blocker decreases acid. Anticoagulant prevents blood clots. Antihistamine / decongestant, seasonal allergies. Anti-anxiety sedative treats anxiety. A laxative makes you poop. Antiemetic treats nausea and vomiting. Diuretic treats fluid retention. Antihypertensive action treats high blood pressure. And anti-angle treats chest pain. So once again, if you need to stop. So, handling and storage of medications. When medications are delivered or you pick them up at the pharmacy, you must record certain information on appropriate forms and store the medication properly before storing them. Check the label against the copy of the pharmacist's order and the medication's administration record. If the label does not match, do not accept the medication from the pharmacy. If you have already accepted it, you must contact your supervisor and the pharmacy. You must record that the medication was received from this pharmacy. Store all medications in their original containers. If a label becomes difficult to read, call the pharmacy and take the medication back to the pharmacy so they can change the new label on the medication. Labels may only be changed by the pharmacy. All medications must be stored in a locked cabinet or cart that is equipped with separate cubicles, plainly labeled, or with other physical separations for the storage of each person's medication. Per state of main regulations, medication for external use must be stored separately from oral medications. Disposing of medications. All discontinued medications, expired medications, or medications prescribed for a deceased person, except controlled substances in individual doses, must be destroyed by the administrator or the administrator's designee and witnessed by one competent person who is not a person receiving services in the home or facility. The destruction shall be conducted so that no person can use, administer, sell, or give away the medication. Individual unit doses may be returned to the pharmacist, and a credit or rebate may be made to the person who originally paid for the medication. Know the agency's policy on this. You must not dispose of any medication alone. So, effects of medication. An important responsibility as a CRMA is to monitor the effects of the medication you are administering. Your documentation is critical information, as the physician determines the effectiveness of the prescriptions. Medications typically produce one of the following effects: desired effects, adverse effects, no apparent desired effect. Both naturally occurring drugs and synthetic drugs are prescribed to cause a desired effect. The effect is somewhat controlled by dose and the frequency the drug is administered. The drugs do not change the physical nature of the primary nature of cells or tissue. They do, however, either enhance or diminish the functions of the cells. Medications can act locally on specific cells, or they can act systematically through larger organizations of tissue, organs, and systems. Examples of local action would include topical ointments designed for specific use, local anesthetics, and topical antibiotic applications. And then drug interactions. When people are on more than one medication, it is very important to understand that drugs can interact with each other and or other substances. It may be that one medication actually produces a desired effect, but in combination with another drug that also has a desired effect by itself produces serious unwanted effects. So that's it for this video. I know we're closing close to 30 minutes, but thank you for listening. There's going to be a part 2 and 3 once I get it done. But anyway, thanks for listening.